Okay, sounds good. Thank you. So it does look like our numbers have stabilized. So welcome everyone. Good morning or afternoon, depending on where you're located. Welcome to the pre-submission webinar for the NIH Office of Disease Prevention and CDC's Office on Smoking and Health's Quit and Thrive Challenge, seeking community-derived solutions to reduce menthol cigarette smoking. My name is Denise Frederick. I'm from the Office of Disease Prevention, and I'm here with my ODP and CDC colleagues to tell you about this menthol challenge and answer any questions you have. Next slide. Let's start with a few housekeeping items. Closed captioning is available for this webinar, and you can access that by clicking the Show Caption button at the bottom of the screen. Next slide. You are in listen-only mode, so you can't voice a question, but you can put a question in the chat. Please direct your questions for the Q&A session to everyone. But if you have technical issues, please direct your comments to host and panelists. Next slide. So we only have about an hour. So today I'm going to review important aspects of the challenge without going into every single detail, but please read the challenge carefully before you submit. And at the end of the webinar, my colleagues and I will answer any questions you have. This webinar is being recorded, and the slides and recordings of the webinar will be available on the ODP website. Next slide. So I'm not doing this alone. I am joined today by Jennifer Arvidres from the NIH Office of Disease Prevention and Trina Pyron and Bob Vollinger from CDC's Office on Smoking and Health. Many thanks to my colleagues for helping develop this challenge and joining us today to help answer any questions you may have. Next slide. Today's agenda is simple. I want to tell you the reasons we developed this challenge and then give you an overview of the challenge. I'll tell you about the challenge eligibility and rules, and we'll follow that with information about submission to the challenge, how submissions will be judged, and give you the timeline for the entire process. You will then have time to ask questions about the challenge. Next slide. Let's talk about background. Next slide. So this slide summarizes why there's a need for the challenge. I imagine that most people on this call know that cigarette smoking is the leading cause of preventable disease and death in the United States. When added to cigarettes, menthol flavoring produces a cooling sensation that reduces the harshness of smoking, which makes it easier for people to start smoking and more difficult for them to quit. Some groups have disproportionately high rates of menthol cigarette use, like youth and sexual and gender minorities. Currently, there are evidence-based smoking cessation interventions that are available, but it's unclear if people who smoke menthol cigarettes need additional or different support, which is the reason for this challenge. Next slide. Now I want to go into more detail about the challenge. Next slide. The NIH and CDC have partnered to develop this challenge to enhance the base of those evidence-based interventions that I just mentioned to help people quit smoking menthol cigarettes. The goal of this challenge is to showcase promising and innovative community-derived solutions to reduce menthol cigarette smoking among groups with disproportionately high rates of menthol use. This challenge is geared towards agencies or organizations responsible for implementing or delivering the community-derived solutions. Next slide. So I keep saying community-derived solutions. What do we mean by that? Community-derived solutions refer to programs, policies, and other strategies that have already been implemented by local or state governmental agencies, community-based organizations, or service providers, and have been shown to be effective in reducing menthol cigarette use without a compensatory increase in the use of other tobacco products. I want to note that this challenge is geared towards agencies or organizations responsible for implementing or delivering the community-derived solutions. Projects that are supported by an NIH grant do not meet the definition of community-derived solutions. And solutions that propose to develop new smoking cessation products or to provide non-FDA approved alternatives to combustible tobacco products are not a priority for this challenge. Next slide. Now I want to give you some examples of community-derived solutions. And please note, this is not an exhaustive list. The first example is solutions that involve local or state laws and policies that affect cigarette sales, taxes, or the number of tobacco retailers allowed in the neighborhood. You can look at implementation of existing evidence-based practices and tailor them to groups with high rates of menthol cigarette use. Programs that increase compliance tobacco retailers to laws that prohibit sales to minors is another example, as well as workplace, housing, or school-based cigarette smoking cessation programs. Next slide. Some other examples include employer or health-based incentives to encourage smoking cessation, or public awareness campaigns about topics such as the risk of menthol smoking and or the availability of smoking cessation resources. I also have some examples of programs here designed to help people quit and stay quit, such as programs that address social needs, such as housing instabilities, programs that provide stress management strategies, or those that offer peer or social support to smokers. Next slide. As I mentioned a few slides ago, these community-derived solutions need to be effective. And although the effectiveness of community-derived solutions can be demonstrated in a variety of ways, the metrics for this challenge should reflect measurable changes in behavior of people who smoke menthol cigarettes. So metrics should include data from before and after the implementation of the community-derived solutions. And they must include data for one or more populations with high rates of menthol cigarette smoking. Some examples of potential effectiveness metrics include, but not limited to, the following: self-reported reduction in cigarette smoking, increased use of local, state, or national smoking quit lines, increased use of evidence-based cessation treatments, decreased sales of cigarettes and other tobacco products, or measured improvements in air quality in indoor communal spaces where individuals who smoke menthol cigarettes live, work, or congregate. Next slide. Let's talk about eligibility. Next slide. So this isn't the most exciting slide, but it is important, so please bear with me. To be eligible to win a prize under this challenge, a participant organization shall be incorporated in and maintain primary place of business in the United States. You shall not be an institution of higher learning, and we have that defined in the challenge. You shall not, at the time of submission, be listed as a primary awardee on an active grant, cooperative agreement, or contract award issued by the NIH, or be a federal entity or federal employee acting within the scope of their employment. You shall not be an employee of Health and Human Services or any other component of Health and Human Services acting in your personal capacity. And in the case of any individuals participating on behalf of a participant organization, you need to be at least 18 years of age at time of submission. Next slide. So if you're interested, I am now going to tell you how to submit a solution, how the solutions will be judged, and give you a timeline for the entire process. Next slide. Before we dig in, I want to go over a few definitions. Participant organizations are organizations that submit the solution for the challenge. The primary point of contact is the individual who submits the solution on behalf of the participant organization and is responsible for all communication with the NIH and CDC. And collaborating organizations or agencies, if applicable, these are agencies or organizations involved with developing, implementing, delivering, or enforcing the proposed solution. Next slide. About your submission. Each participant organization is only allowed to submit one solution. Each participant organization that enters the challenge is required to identify a primary point of contact who submits a solution on behalf of the participant organization. And submission requires a complete submission package, which includes 4 things: an entry form, description of the community-derived solution, references, and additional collaborating organizations or agencies if applicable. The entry form is simple and requires basic information, including the title and brief summary of your community-derived solution. The description of the community-derived solution is limited to 10 single-space pages, and that includes everything: figures, tables, graphs, everything. This is the meat of the challenge, so please make sure you read the challenge carefully, and please contact us with any questions. This section seeks information on 5 points: overview of the community-derived solution, relevance to populations with high levels of menthol cigarette use, innovation, evidence of effectiveness, and potential for sustainability or broader implementation. Some of what we're looking for in the overview of the community-derived solutions was like the type of solution, like is it a program or a policy? When and where the solution has been implemented? What populations are the focus of the solution? Who developed and or delivers the solution? How the implementation, delivery, or enforcement of the solution is funded? The role of participant organization in developing, implementing, delivering, or enforcing the solution, and if applicable, the role of any collaborating agencies or organizations in developing, implementing, delivering, or enforcing the solution. For relevance to populations with high levels of menthol cigarette use, we want information like how the solution reaches or impacts those populations with high levels of menthol cigarette use, and how the community-derived solution specifically addresses menthol cigarette smoking. For innovation, tell us how the community-derived solution differs from other efforts to reduce menthol cigarette smoking. And are there any novel or creative strategies used to develop, implement, deliver, sustain, or evaluate the solution? For evidence of effectiveness, we would like to know the process for collecting evidence of effectiveness for the solution, including the metrics, tools, and measures used, how and when the data were collected or obtained before and after implementation of the community-derived solution, how the data were compiled or analyzed, how the collected data showed the community-derived solution produced changes in smoke-related behavior, included how the changes can be attributed to the community-derived solution versus other factors, how the changes are specific to or inclusive of populations with high levels of menthol cigarette smoking, and how changes are specific to or inclusive of menthol cigarette smokers. And last but not least, tell us about the potential for sustainability or broader implementations of your solution. Like, how can the community-derived solution be maintained or sustained in the future? And how can it be delivered in other locations or settings? As I mentioned before, the submission package also requires references. And also, please tell us about any additional collaborate agencies or organizations if applicable. Next slide. So let's say you've met all the requirements and submitted your community-derived solution. Who evaluates it and how will it be scored? It will be evaluated and scored by qualified federal employees using the following scoring rubric that consists of 4 criteria: relevance to populations with high levels of menthol cigarette use, innovation, evidence of effectiveness, and potential for sustainability or broader implementation. I want to go into a little more detail about each of these. So up to 10 points can be given for relevance to populations with high levels of menthol cigarette use. Here, our experts will be looking for the extent that the community-derived solution addresses menthol cigarette smoking in populations with high rates of use, and to what extent were members from the population or communities of focus included in the development, implementation, or evaluation of the community-derived solution. Next slide. Innovation in 5 points. Experts want to see the extent the community-derived solution includes new or novel programs, policies, or other strategies. Evidence of effectiveness is 20 points. So are appropriate and convincing measures or metrics of effectiveness provided that indicate changes in smoking-related behavior? Are data provided that are specific to menthol cigarettes? And are data provided that are specific to individuals or populations with high levels of menthol cigarette use? Potential for sustainability or broader implementation is 5 points. How sustainable is the community-derived solution? And to what extent can the community-derived solution be implemented in other locations or settings? Next slide. So I've given you a broad overview of the challenge and discussed eligibility requirements and rules. I've also told you how to submit your community-based solution and how it will be scored. I now want to share the timeline for the process. So the submission period for this challenge started November 1st, 2024, and the submission period closes February 28th in 2025 at 11:59 p.m. Eastern Time. The submissions will be judged between April and May of 2025, and awardees will be announced in July of 2025. Next slide. Next slide. So now I would like to turn this over and so we can answer any questions that you have. Thank you.
Okay, great. Thank you, Denise. I am Kat Schwartz. I am from the Office of Disease Prevention, and I will be kicking things off with a couple of questions. As a reminder, you can pop any questions or comments in the chat. Please just direct them to hosts and panelists, and I will try to read them off as they come in with the help of Jennifer Alvidrez. So first question we have, can collaborating organizations or agencies submit letters of support as part of the application?
So in the challenge, you'll see the required documents. Those documents will be what will be reviewed for the judging. So if you submit anything extra, it won't be considered. So you might as well not do that. There is, you should list the collaborating organizations in the entry form, and in the overview, describe the role of the collaborating organizations and agencies. And you can also talk about it elsewhere as relevant in the application packet.
Okay, great, thank you. Let's see. A question from Nikki, are there templates to guide from?
So there's not a template. So the entry form has fields that you fill out. The instructions do tell you what sections to include. So it's pretty close to being a template. You know what headings and sections you'll need, and then you can populate it with whatever's relevant to your entry.
Okay. They're starting to come in now. So next question. We are a community agency. We have a other transactions agreement with NIH through which we're doing some community research. Would we be excluded from submitting an application?
If you're the prime recipient of the award, we would consider that to be in the same category as a grant or cooperative agreement. So if you have a subcontract, that would be different. So feel free to reach out to the mailbox with specific questions about your situation, and we can respond in more detail.
Okay. And I will put the email in the chat as well. We have it on the final screen as when we end the webinar, but moving on to the next question. What are the requirements for how the awarded funds are used?
So there are no requirements because it's a prize for submitting the best solutions rather than a grant, which is really a plan to do something in the future. So there are no restrictions. We do hope that the winning organizations use those funds to sustain, expand their programs, their solutions, but that is not a requirement. There's no oversight once you win the prize.
Okay. Let's see. What sources of data collection are recommended?
It really depends on what your solution is. So some may lend themselves to looking at publicly available data. Some may be more relevant to asking people who smoke what their smoking behavior is. So it's really going to depend. And we're happy to chat with you in more detail about your particular solution. And you can go ahead and put that in the challenge mailbox.
Let's see. Another question. I'm employed at Roswell Park, New York State Quit Line. I would not be submitting through them, but would collaborate with them and other Buffalo, New York organizations. Am I ineligible?
So regarding individual people, so remember, it's the organization that is really putting in the entry, and a contact person, presumably within that organization, would be physically submitting the application. So the only restrictions for the person who submits are related to being a federal employee. So if you're not a federal employee and you're over 18, there wouldn't be any other restriction.
Okay, great. Let's see. Probably a little bit related. Is it possible for someone to submit the application individually without being affiliated to any organization?
So this challenge is geared towards organizations, because typically organizations, rather than people, will be implementing things like laws and policies or services or programs. It is possible to have a one-person organization that would allow you to qualify. So if you have a situation like that, again, feel free to contact us and we can get into more of the detail.
Great. This is kind of an inner workings question, but there's a question in the chat about how can a federal government employee be involved or volunteer to review submissions? A little bit.
Yeah, that's another thing you can put. It will be federal employees who will be the judges. So feel free to put your name and shoot that over to us in the mailbox that you'll see at the end of the screen, end of the slides.
Great. Let's see. Do you diversify the awards for adults versus adolescents or solution suggested? I'm not sure if we need more context there or.
We didn't specify any categories that the judging would be based on, so we don't have plans. We do, of course, hope to have winning solution sort of spread, geographically, type of organization, but we don't have that as a judging criterion.
Okay. Let's see. The essence of the question is a harm reduction strategy a plan to convert menthol cigarette smokers to a less dangerous form of tobacco use on the table or off the table in terms of proposing a solution?
I'll answer the first part, and then if my CDC colleagues want to add anything. So harm reduction is on the table in that a reduction in number of cigarettes smoked or other kinds of reductions, but not just switching to another tobacco or alternative product with no reduction in intake, if that makes sense. And if my CDC colleagues would like to add anything to that, please jump in.
No, I think that makes sense, Jennifer. I don't know that there would be anything. Well, I guess it would depend on the circumstances of the specific situation. But to try to switch to another tobacco product doesn't seem like it would be responsive.
Right. I mean, certainly if someone smoked 3 packs a day of menthol cigarettes and the outcome was they now smoke 3 packs a day of non-menthol cigarettes, that certainly wouldn't be of interest to us. It would be the overall reduction, particularly in the menthol cigarettes, without a substitution and equal or greater use of alternatives, certainly.
Okay, great, thank you. Very interesting question. Back to, it looks like eligibility criteria. Can a for-profit organization apply? And then to piggyback off of that, we have another one. The organization has to be a 501c3, correct? So
No. I think we originally had that on the website by mistake, if you saw an early version. So no, for profit, as long as you're domestic, so located in the US, not a institute of higher learning like a college or university, and not a federal agency.
Okay, hopefully that answered those two questions. Let's see. Again, these are kind of linked. So first, how many submissions are we expecting to receive, and how many awards would be granted?
So we don't really know. This is the first time we've done this challenge. So we hope to get a robust response, but we don't know. We are planning to fund up to 9 awards at $100,000 each.
Okay, great. Just to confirm, since this is a prize, there are no reporting requirements back to NIH once the prize money is given, correct?
Correct.
Okay. Let's see. Just a reminder, keep on adding your questions to the chat and we will get to them. We've got plenty of time, so no worries there. Can a document on allowable expenses for the award budget be made available?
So this is kind of related to the previous
Mhm.
question. There is no monitoring. Don't do anything illegal with those funds. We hope you'll use the funds to continue your program, your solution, whatever it is, but that's not a requirement. So there's no, you don't submit a budget, and we will not be involved in what you do with those funds.
Okay. This one from Rachel. How long does it take to get a law passed? We would like to have timely data to submit the answers.
So probably a while. If you're not already involved in getting local legislation passed, that's probably not going to be a viable solution. So that's mostly for folks who are already kind of in that space. Other programs, if you haven't started yet, I think a law would not be probably an option for your organization.
Okay, great. Makes sense. Another one that just came in from Carol. Can an organization submit multiple applications? I guess maybe that means multiple solutions.
Right. So only one solution per organization, and we would typically define an organization as having a distinct, unique identity ID with the federal government or a tax identification number to show a distinct organization.
Okay, great. Any thought about including vaping language to menthol smoking or cigarette use?
Yeah, so at this point, we're not adjusting the challenge language because it's been posted. Sort of similar to the earlier question, we're looking to see a reduction in menthol cigarette smoking, not just substituting with other. So, a solution where you give people e-cigarettes, for example, to see if they smoke is not a priority. And there's language to that effect in the challenge. And Denise also mentioned, I think, in her slide.
Okay. And then I'm not quite sure what these the acronyms are for, but maybe you will know, Jennifer. Are special considerations given to MBE/MWBE as the lead organization or organizations that work with these types of organizations?
Right. I think this is referring to minority owned
Okay.
or women owned. We, other than the eligibility regarding organizations, we're not prioritizing any type of organization over another. We'll just be looking for the most compelling solution.
Let's see, another question got one from Kimberly. Can projects or programs that have the same fiscal sponsor or agency apply? Or would that be considered multiple applications?
Right. I think that's a complicated question, because unlike a grant where an organization may use their fiscal sponsor to administer those grant funds, this is a prize. So any type of organization should be able to accept the prize and do what they want with it. So again, a complicated question about whether the organization or the fiscal sponsor is the one submitting the application. Certainly we don't want to see applications that have the same entry, the participant organization. But I think it's possible that the individual organization can submit on its own behalf, even if the fiscal organization submits, helps with the submission of more than one entry. Please contact us, put it in, and we can talk about it. But I think that considerations here are different than applying for a grant.
Okay. It's an interesting question that just came in. In the application, do we have to show the innovative ideas with pictures or videos, or can we just describe it with words?
So you can include pictures in your submission. Because we didn't specify that additional materials could be considered, we unfortunately wouldn't be able to include videos or other material like that that's not included in the primary documents. We wouldn't be able to consider that or judge. So mostly words, but pictures as well.
Okay, great. Let's see, another eligibility question. Can a collaborating organization be a university with a study from the university? So the organization can cite the research to argue effectiveness and timeline.
Okay. So a collaborating so the university would be the collaborating organization. So the participant organization needs to be responsible for the community-led solution. So unless that's the case, just sort of switching the university from the participant organization to a collaborating organization, but it's really a university research project, wouldn't be what we were looking for, because we're looking for the participant organization to really be the responsible organization for implementing whatever the solution is, or developing it, or enforcing it. So again, sometimes the answer is, in the weeds of the details of your situation. So please do ask that question in our mailbox, and we can get back to you on the specifics.
Great. So for the actual application package, should figures like potential workflows be attached separately so it does not count toward the 10-page application limit?
No, tables, figures, charts, images should all be included, or if they're included, they need to fit within the 10-page limit.
Okay. Let's see. It looks like all we have in the chat at the moment. I will keep, just one more. Transcripts from the meeting will be available. We will be posting a captioned recording of the webinar as well as a copy of the slides. It will be on our website in roughly 3 weeks. So you can always come back and revisit it. Let's see. That might be all we have in the chat right now. I don't know, Denise, Jennifer, Bob, if there's anything else that you would like to cover. We can always, we've got plenty of time left.
Right. I think we can talk about some of the other questions that we've received. So we've kind of sort of answered this already, but this is related to collaborating organizations. Do the collaborating organizations need to meet the eligibility requirements the way the participant organization does? And the answer is no. Those eligibility requirements are just for the participant organization. A related question is, do we need to specify how the prize will be distributed to all of the participating organizations? And the answer is no, because there's no monitoring or oversight of the prize money. So the participant organization would receive the prize money, and it would be up to them to work out with their collaborating organizations how to distribute those funds.
Okay, we just got a new question that came in. Can you cover copyright usage and how the individual can still hold some royalty to work?
Right, and Kat, please add anything to this. But so, and this is according to general challenge guidelines, not just this particular challenge. But by entering the challenge, you grant NIH and CDC the ability to use the materials, but it's non-exclusive. So you can continue to use the materials or whatever it is as well. Let me know if that answers your question, or Kat, if you want to elaborate.
Yes, I think that covers it. I'll put a little bit more information in the chat about copyright and usage, but that it was correct. Where can I find the grant application?
So, and we'll show this on the last slide, but on the ODP Quit and Thrive webpage, you'll see links to the entry form that you will download and fill out, but the rest is just like a Word document, something like that, that you use following the instructions about the specific information that you need to include in your submission. So there is no application packet the way there is for like an NIH grant. I can say another word about this copyright stuff. So our goal at NIH and CDC is not necessarily to take a program and implement it ourselves. We just want to identify some of the best solutions out there and have that inform research initiatives or other initiatives that we put forward to build the evidence base. So it would not be our plan to take a proprietary training manual or something like that and sell it or something like that. It's more to showcase great ideas and try to encourage more research to evaluate these kinds of solutions.
Great. It looks like you've got another kind of process question. Is the application form considered part of the 10 pages?
No, the entry form is just a separate form that you download, and then the rest of it is the 10 pages, plus the references are separate, and additional collaborating organizations and agencies, that form is also separate.
Okay, I'm just checking our chat and our mailbox. I don't see anything else at the moment.
One other question that I remember is regarding the holding an NIH grant or cooperative agreement. Our organization has an NIH grant, but it's not on this topic at all. Would that affect our eligibility? And because the prize is geared towards organizations and eligibility is geared towards organizations, if your organization has any active NIH award, that would make you ineligible to submit a solution for this, even if it's unrelated to the solution.
Okay, we still have plenty of time, so if there are other questions, feel free to drop them in the chat. Otherwise, Denise, Jennifer, were there other questions that you had wanted to either circle back to or that you had gotten before and thought it would be helpful for everybody to hear?
I feel like we've gone over a lot of them. Jennifer, can you think of more?
Yeah, I mean, thinking about, so one of the things that we're asking for is demonstrate the effectiveness of the solution with some sort of data. What level of data is necessary? I think, like I mentioned before, that is really related to the type of solution. We do emphasize that we would like to see pre-post data. There is some flexibility if we're saying we need some sort of pre-data and some sort of post-data. Some organizations may have implemented a solution but didn't collect the pre-data in the same way they're collecting their post-data, if that makes sense. So there is some flexibility as long as you make a case to not have the exact same data, as long as you can make the case that the data you're presenting show that your solution is really reducing menthol cigarette smoking or purchasing. So there is some flexibility in that, but we are looking for data before and after the implementation of your solution.
See?
Is there anything else? Anyone have any other questions?
Oh, there's a couple more. Oh, here we go. A couple
Yep.
more coming in. So I think this is a repeat. Can an organization submit multiple solutions? And that is no. Okay.
So you could be a collaborator organization on another organization submission. there's no prohibition against that.
Helpful clarification. Okay. I don't have an NIH award, but I'm thinking about partnering with a university, but they have an NIH award. Is that a problem?
So if you're submitting on behalf of your organization that doesn't have an NIH award, a prime as the grantee, I should say, of an NIH award, yeah, that would be fine. Though keep in mind that we're looking for community-derived solutions, not research projects. So whatever you submit, even if you're working with a university, would have to be the solution that your organization is responsible for initiating, developing, delivering, enforcing.
Okay, like that answered the question. I just put our email address back in the chat. If you have more questions after the webinar, if you just want to reach us too. Let's see. Okay, that's all I see at the moment.
Last call for questions in this space. All right, next slide. So I want to thank everyone on our panel for joining us today, and thank everyone from IT for helping us with everything. And I especially want to thank everyone who joined today to learn more about this challenge. We would love to hear from you. These are all the ways that you can contact us. And please don't hesitate to contact us if you have any questions. So we really appreciate it, and we hope to hear from you soon. Thank you. Have a good day.